Finally, the last drug on here that I really want to talk about, there's a couple on here, but the big one is amiodarone. So amiodarone primarily is going to have class 3 properties. Remember, that's going to be potassium channel inhibition, but it actually has some of the properties of all of these different drugs. And just so happens that class 3 is probably the most prominent of those effects. Okay, but it can inhibit sodium channels. It can cause slowing of the heart rate via decreases in CAMP. It can inhibit calcium channels potentially. But the big thing, like I said, is this potassium. So what can you expect from amiodarone? Well, let's see. If I am a class 3 antiarrhythmic, which it primarily is, you can get QT prolongation, right? Because you're inhibiting potassium current, right? And that potentially can cause QT prolongation. If I'm a class 1 antiarrhythmic, right? I think my classic one, my 1A, which is right in the middle, that's going to inhibit sodium current. That can prolong my QRS. Okay, so you can get a prolonged QRS as well with amiodarone. And if I think about class 2 and class 4, I'm mostly thinking about a PR prolongation, which you can also get with amiodarone. So amiodarone can cause all of these effects. Okay, so that's particularly important to remember. There's a lot of other effects on here, and we'll talk more about these in a future video, but pulmonary fibrosis is a very big one. Thyroid disease, because you got to remember amiodarone is almost half iodine by weight. So iodine, when we talk about the endocrinology lectures, can have a lot of disruptive effects in the thyroid. And so usually you have to get like a serum TSH before you start a patient on amiodarone. Okay, that's very important. Amiodarone can cause cardiovascular disease, but see, cardiovascular disease and liver disease, they can present this to you kind of in a subtle way, but you can't really present blue-gray deposition in the skin and cornea in a subtle way because there's not a lot of things that cause that, right? So when you see some of these different pathologies linked in a patient that has a history of arrhythmias, for example, think about amiodarone. Now, sotalol, I already kind of hit on this, so I'm just going to briefly say that, again, this has properties of both class 2 and class 3 because it's a beta blocker and because it inhibits the potassium channel. So you can get PR prolongation and QT prolongation with sotalol. And also bradycardia, right? That's one of the major side effects you would expect with a beta blocker. Finally, this last one on here, this anti-anginal agent. We'll talk more about this in the angina lecture. I just put it in here because it also has, some relevancy in that it inhibits sodium and potassium channels in ischemic cardiomyocytes, and it can cause a dose-dependent increase in QT. However, this particular drug is really not known to cause torsades, which is interesting because it can increase the QT. But out of everything in this lecture, probably the least high yield thing. I just want to include it for completeness sake.